Welcome, everyone. Thank you so much for joining us today. We're excited to see there's a good number of people on. Welcome back if you joined us for the first session of our Vaccination Station 2.0, and welcome for the first time if you're just joining us for the first time today. My name is Jenny Lingle, and I'm a Senior Improvement Advisor here with Comagine Health. And this is our Vaccination Station 2.0, session number 2, which is initiating that planning process. So a quick blurb about Comagine Health, if there are people who aren't familiar with us. We are a national nonprofit healthcare consulting company. So we work collaboratively with patients, providers, payers, and other stakeholders to reimagine, redesign, and implement sustainable improvements in the healthcare system. And specifically, we are working with long-term care facilities, and one of the areas is around immunizations. So here's our team who is working to bring you this information and is here to support you in this journey. We are available, obviously, during this time. We also have a monthly office hour where people can come with questions if you need more information or resources. We'll also have our emails at the end, and you can reach out to us at any point in between our vaccination stations or open office hours if you need extra assistance with vaccines. So a few housekeeping items. Please use the chat for questions and comments. There'll be a time for you to come off mute for discussions, but when we're not having a discussion, please remain on mute. And then feel free to click on reactions. And if you're joining us by phone, please dial *6 to mute and unmute yourself. Note this session is being recorded, and all of the recordings and resources will be emailed out as soon as they become available. So we will be emailing both the recording and resources we share. Okay, so quick overview about Vaccination Station 2.0. We really wanted to help facilities pivot from kind of an urgent, reactive approach to immunizations that we've all been operating under for the past 3 years to really shift to a more proactive, planned out approach to vaccines. Our hope is that this makes the process less stressful, decreases the amount of burnout related to vaccines, and also increases the amount of staff and residents who get vaccinated just by being more planned out and having a more systematic approach to the vaccine process. And we will have a survey at the end of our session. It takes about 2 minutes to fill out. We will drop the link in chat. It will also pop up when we log off Zoom. And we ask that if everyone could take 2 minutes to fill that out, we would really appreciate it. As a quality improvement organization, we really value feedback so we can improve our offerings to meet the needs of our partners. So please take a minute and fill that out at the end. So this is our series outline for the vaccination station. June was the evaluate and review the previous year, how that went for your facility. And today we're going to be talking about initiating that planning process. So we identified last month strengths from the previous year, identified opportunities for improvement, and began discussing laying out the foundation for your upcoming vaccine year. We talked about obtaining leadership support for vaccine campaign and recruiting and assembling a vaccination campaign for the upcoming season. So for anyone who missed that session, we have the recording, slides, and worksheet as long as the key learnings document available. And we'll drop that link into chat so that you can go back and catch up on it. If you missed last time, we would encourage you to look that over to really set a solid foundation for moving forward for this coming year. So since we last met, we asked people to work on acquiring leadership support for a vaccine campaign for the upcoming year and starting to recruit and assemble your vaccination team for this coming year. So we realized there may have been kind of a variation on what people needed to do. Some facilities may already have high-level administrative support for vaccines, while others may have really needed to work on that. So is anyone willing to share if they were able to do either of these things in the past month? talk with your leadership about support for a vaccine campaign this year, and or recruiting and assembling a vaccine team, starting to gather support. Just wait a minute in case anyone is getting up the courage to share maybe something that happened in the past month as they started to work on this. Did anybody try and maybe hit some barriers? We know that that is a real part of improving the system is hitting those barriers.
I'll go. This is Amy at Sunshine Health and Rehab. I already had some pretty good administrative support prior to me taking on this role. But I was able to add a couple people who I think will be able to help me get the campaign going in my admissions department.
Okay, so were they clinical people or administrative? What roles?
So my administrator is an RN, and then my DON is also an RN, and my admissions team, both my intake nurses are RNs, and my admission nurse, I have one RN and one LPN.
Excellent.
Yeah.
So you were able to get some of them on board for this process.
Yeah. Yeah.
Great. Thanks, Amy, for sharing. Anyone else want to share? Okay, and we'll talk more about kind of thinking outside the box about other types of people within your facility who may be helpful to have on the team as well. Okay, so today's objectives is we're going to talk about planning and holding your actual vaccine campaign kickoff meeting. So actually getting together people on your team, what information should be decided on that meeting, how do you communicate and convene that team. We'll talk about the need to begin monitoring flu, COVID, and pneumonia updates, which I know can be a source of burnout and feeling overwhelmed, but we're going to try to come up with kind of a systematic way to stay on top of that information. And then also finalizing key details of that vaccine campaign plan. We'll bring up some things to consider, and then laying the foundation for the planning and promotion of it. So that's where we're headed today. So at our last session, we introduced this planning worksheet. We used last session to kind of look back at the previous year and see what were the vaccine rates for flu, COVID, and pneumonia, identifying strengths, weaknesses, opportunities, and then some threats to achieving your vaccine goals for this year. So we have added to this worksheet, we've added 2 extra pages. So pages 1 through 3 are from session 1. So if you already worked through those pages, you can kind of skip them. And we've added page 4 and 5, which we'll be working through today, that are really to use for planning these next steps. So if you missed last session, please download this worksheet and start on page 1 and fill it out as best as you can, page 1 through 3, and then move ahead to page 4 and 5. If you were at last session, feel free to just skip ahead to page 4 and 5 here. Okay, so the vaccination campaign kickoff. First step is assembling your team. Second step is planning and holding a vaccine campaign kickoff meeting to get things started. So activating your team, that's really finalizing the team members who's going to be a part of this process of vaccinating residents and staff. You want to establish a team email group for official email communications. For some people, that may seem like a really basic step, like, oh, I do group emails for all of my different teams. For some people, you may be like, I'm not even sure what you're talking about. What is a team email group? So I know that there are different email servers people use. We were going to do a demonstration for this, but realized it would be hard to meet everyone's needs. But with each different type of email you use, so whether that's Google or Outlook or something else, there's a function where you can create a team email. So instead of having to type in everybody's email addresses each time you want to send an email to that group, you just type in the name of the group that you've already created. So if that's a new thing for you, please reach out to us. We can help you set up that email shortcut. it can sort of take the time, it can reduce the amount of time you spend communicating with your team if you can get that email group set up. So that is a first important step, is getting that email group set up. And then determining your cadence of your meetings and email communications. So how often do you want to be meeting with your group? How often do you want to be communicating with them? It can be a fine line of not communicating enough and people sort of forgetting about the work or forgetting about the tasks that they should be working on, versus over communicating and people starting to ignore emails because they get them so frequently. So determining both the cadence of your in-person meetings with your team, also the cadence of your email communications. And again, if you need help doing that, please come to our office hours on July 27th, and we can walk you through getting a team email set up and maybe even talk through the cadence of meetings and emails for timing. So then scheduling the kickoff meeting, and this can be tricky because sometimes with shifts, people there at different times of day. So finding a time where everyone's there and that everyone can take a minute from their day-to-day work to meet can be challenging. So really starting to identify the dates and times in advance so people can block off their calendars to attend that kickoff meeting, and then sending the calendar invite so people can block off their calendars. And again, getting your email communications up and going. Again, this seems like a pretty basic step, but oftentimes not getting that meeting scheduled enough in advance can lead to it never happening because it's just difficult to find the time. So really looking ahead and trying to get that meeting scheduled sometime in the next month to get everyone together and to talk through some of the steps we're going to list out next. So what are you going to talk about at this kickoff meeting? So you identify the people you want in your group, and then you set a time and you send out that time. Now we're going to talk about developing the agenda for it. So one of the first things is really identifying and discussing the target audiences for your facility. So for most people, there's two main target populations. There's your residents and then there's your staff. So coming up with a vaccine plan for residents, and within your residents, you may have different groups, maybe more high-risk groups versus less high-risk groups. You want to prioritize that more high-risk group first, perhaps. So there is some options for kind of breaking down your resident population. And then staff, and how you approach a vaccine campaign for residents is probably going to be pretty different than how you approach it for staff. So that's why we encourage you to really break out those two populations at a minimum. Again, within residents or staff, you may have subpopulations as well. So once you've kind of identified your target audiences, reviewing and selecting Comagine or other internal educational and promotional materials. So this is important because we know from experience and also from studies that when people get education materials in advance, or when they have opportunities to discuss vaccines in advance with people that they trust, which is hopefully you and your staff, they are much more likely to agree to be vaccinated than if someone just walks into their room and says, hey, are you ready for your flu vaccine? Do you want your flu vaccine? And I would love to hear from you guys. It seems like a lot of people tend to look at vaccines at admission into a facility and get consent at that point, at admission. It seems like there's not a lot of trust built with a resident at that point if they're just being admitted. So thinking through ways that you can circle back with residents who've maybe declined previously in a non-urgent manner. So offering educational material, taking time for some real sit-down conversations that aren't rushed, and there's no urgent need for them to make a decision. Like, we need you to decide right now whether you want this flu vaccine or COVID vaccine. So that's the idea behind choosing educational and promotional materials in advance, is you want to give both staff and residents time to really look them over and digest them, maybe putting them up in your facility in an area like where they eat, where people will look at them kind of naturally in communal areas, and they have time to read and think and digest well in advance of the time that they will be offered the actual vaccine. So I'm going to pause there, and I'd love to hear from you all about how this looks at your facility. Do you have a process where you post educational materials? Where is that? Where do you find your educational materials? And then do you have a process where you kind of plan out educational and promotional events in advance already for vaccines? Okay, so if no one's doing that, then this is a pretty big step to think through. And if you need help, like we don't have any educational material, we at Comagine have a lot internally and externally that we can recommend. So we'd be happy to talk through that with you. We can also review any materials your organization may already have, just to make sure they're updated or make suggestions on them. So this sounds like it's a great focus point for the next month, is maybe looking at educational materials for both your residents and staff and promotional materials. So another key agenda item for your kickoff meeting is exploring the possibilities of incentives and rewards. And we realize that this can be a bit controversial, offering incentives to be vaccinated. So if you know that this wouldn't go over well in your facility, of course, feel free to not implement this. But it does go over well in some environments to offer incentive and rewards. So for staff, there's ideas like gift cards to local restaurants or coffee shops, PTO awards, offering an extra day off or a half day off. Those things can be really powerful for someone who's maybe just on the fence or who tends to drag their feet. If there's a cutoff date, like if you receive your flu and COVID vaccine by this date, you'll be entered into a drawing for this. That can be a helpful incentive. For residents, it's a little bit different, and will probably incentives might require some creativity on your part. Oftentimes the staff knows what residents really like, whether it's an internal thing, if bingo is really popular, offering an extra bingo incentive, or, oftentimes staff know residents and know what residents really enjoy and like. So thinking through that as part of an agenda item is, are there incentives we can offer to staff and residents for being vaccinated? Does anyone already have an incentive program that they have been doing in their facility? I'd love to hear if you have and what you've seen by offering incentives. Okay, feel free to hop off mute at any point or type into chat. So then another agenda item is defining all the resources and supplies you'll need to support the campaign. Again, this can seem kind of like busy work a little bit, but these are oftentimes the things that make vaccine campaigns kind of not go smoothly or be really stressful for staff, is when you don't have the resources that you need. So some things to think about is, what is your budget for the vaccines, for supplies for vaccines, and if you're going to offer any incentives to staff or residents, what's your budget for that? And then your human resources. How many staff are you going to need? Are there any areas where you could recruit volunteers to help with a vaccine campaign? Interns, a resident champion? Do you have residents that are super passionate about getting vaccinated and would love to be a champion with their other residents for that? And then actual physical resources. So again, that educational and promotional material, but also things like tables and chairs if you need them in an area for a vaccine event. Postcards, mailers home to families or powers of attorneys, and then signage to go with it. So thinking about this in advance now can really help you line out both your budget and your staffing needs and have that all lined out so that it's not that super crushing, stressful running around in September and October trying to figure that all out. And then, of course, as an agenda item, determining the actual dates that you want to do some of these vaccine clinics, so to speak, and the locations where you're going to do them, and if you're going to have any fun themes that go along with it, any promotional things. Any questions, comments about this? Maybe take a moment on that worksheet that we've provided and jot down, there's a place for you to jot down some of this information. So I'll pause and give people a minute to fill that in on your worksheet. I know it can be difficult after you log off and have to start work again to do that. So I'll pause and give everyone a minute or two to jot down some of this information on your worksheet. And just a reminder that we do have office hours available. So if you are stuck on one of these, like I have no idea what resources I need, or I have no idea to go about how to figuring out where to get this, please join us for those office hours. That's where we can really answer one-on-one questions. And I know it can be intimidating in a group meeting sometimes, like, I don't want to ask about this if no one else has this problem, but I want to assure you all that if you are struggling with something, for sure, there are many other facilities struggling as well. So please don't hesitate to put those into chat or come off mute. But if you'd rather get some one-on-one help, please come to our office hours and we can really help you with that. And I see Aaron just put something into chat. He said, we partnered with a local nursing college for the nursing students to administer to our campus, along with our 3 licensed care areas. They were super grateful to help us out. Just another resource. Aaron, that is such an awesome tip. So there are many healthcare programs at universities and colleges that really need their students to get experience, and partnering with those. So College of Nursing is a great one. College of Pharmacy is another one. Pharmacists give a lot of vaccines once they actually start practicing as a pharmacist. So those pharmacy programs are always looking for their pharmacy students. And of course, if you live near a medical school. So Aaron, great tip. Just reaching out to those programs and asking if they want to partner with you is a great tip and can really cut back on the number of staff hours that it takes to give those vaccines. Aaron, do you have any other things that went really well with that? Did you have the nursing students also document the vaccines that they gave, or did staff document the vaccines? Would you be willing to share that piece with us? Okay, Erin, if you get to it, I'm not sure, just let us know how those details worked, because the documenting is always a tricky part too. Okay, great. So Erin said, yes, we created them a nursing student account on the alerts immunization registry. That's awesome. So I didn't know that you could create a nursing student account. That's a great tip. Thanks, Erin. Does anyone have any questions about that? I feel like that's a really great idea, and great to know that you can create a nursing student account for them to document in. Okay. Anna shared that their EHR is also interfaced with. Can you let me know what that abbreviation MICC is? Is that your documentation, your state immunization registry? I'm not familiar with that abbreviation. Sorry, Anna. Oh yeah, your state vaccine administration. Perfect. That's great. If the EHR connects with the state system, that's ideal. That's safe. I know in my nursing career, I've spent many hours entering in vaccines that were already in our HR into the state system. So if it interfaces, that is a huge time saver. That's great. Okay, thanks guys. Thanks so much for sharing. That is so helpful. And really, we love bringing everyone together to be able to share that information. So please feel free to share as we go along. Okay, so we're going to move into talking about monitoring the flu, COVID, and pneumonia updates. And we know that this has been a source of burnout and stress for everyone. It has just seemed like a constant stream of updates in the past 3 years. So we do anticipate that that is going to slow down with COVID now, that the emergency phase of it is over, and that we are going to move into a more steady state with the vaccine recommendations for COVID. But we are going to talk through this and how you can be monitoring the most up-to-date guidance around vaccine recommendations, also your local and national flu, COVID, and pneumonia rates, and really talking about how pneumonia is linked to readmission, all of these really, and how that plays into vaccines. So we have some sources here in case you are not already monitoring these different sources of places you can go to check in regularly for updates on vaccines, vaccine guidance. Comagine can also be your one-stop shop. We are here to help and would love to help answer questions, track down answers for you if you're not sure on what the newest recommendation is for giving a vaccine or timing between vaccines, any of that, we're here to help. So please don't hesitate to reach out. We have, again, this session, but also our monthly office hours. Okay, so we realized that how the CDC has been monitoring COVID data has changed. So CDC is still tracking it, but it's different than it was earlier in the pandemic. So now that the public health emergency is over, COVID reporting has changed. CDC is now reporting community levels of COVID by hospital admission levels. So we are going to put a link in chat that you can actually use this link to kind of drill down on your county COVID levels from this link. And hopefully that will help you be able to monitor kind of what it's looking like in your area. This can be helpful just as you're talking with staff and residents to know what's going on and to know actual risk for your area. Any questions about this? Is this new? Have you guys already been tracking through this site? Are you tracking in a different way? Have you stopped tracking completely because you've just had enough of it? We know that that's a reality for some people as well. Okay, I see Erin put a link in for the Oregon site. That's awesome. Thank you, Erin. And Edie also put in a link for RSV vaccines. Those were just recently officially approved for certain patient populations that are 65 and older. The wording is it's supposed to be a shared clinical decision between the patient and the provider. So we are more than happy to provide more information about that new RSV vaccine if needed. They are recommending that it be given at the same time, kind of during that respiratory season as flu and COVID. So we don't want to ignore it. We also know that it may not apply as broadly to all of your residents. So if you need more information, please let us know. We can meet with you one-on-one or provide more resources in our key learnings document. Okay. So then finalizing the key details of your campaign plan. Again, getting that administrative approval. So oftentimes in the hustle and bustle of work, it can be easy to think that our supervisor knows what's happening or maybe just needs to know at the last minute. But especially with budgeting and supplies, it's good to give them a fair amount of leeway time to look over what you need and your budget for it, and they may have to run it through certain people as well. So as you're working on pages 4 and 5 of your worksheet, really thinking through who else do I need to communicate this plan with? Who else might I need to get approval for these items from? And communicating with them early, sharing that information with them early we think that by having filled out the worksheet and having a really specific idea of your budget, the supplies that you need, the staff that you need, that goes a long way in getting what you need versus being more general. It's harder to get approval for very general things, typically easier if you're very specific about what you need and why. So temporary, so again, staff needed, this could be volunteers, or like Erin mentioned, reaching out to a school of nursing or pharmacy or medical school, and that can be a great idea. And then any temporary resources, so extra tables, chairs, things like that. And then coordinating with your vaccine partner. So this is, we're going to pause here and do an actual poll because we want to know how many of you have actually ordered your vaccines for this next season. So thinking respiratory vaccines, so flu, COVID, pneumonia. We'd love to actually see that. So we're going to pause and launch a poll and just kind of get an idea of who's already ordered and who hasn't, and maybe you're unsure because you work with an external vaccine partner. So Riley, are we able to launch that poll? Okay, you might be having some technical difficulties. So
I think we are, Jenny. It doesn't look like the poll is coming up. Sorry about that.
Okay, that's okay. So if anyone can just type into chat, we'd love to get an idea of, you can just put yes, no, unsure, if you've ordered vaccines. Thanks, Nicole. This is helpful. Okay. So there's kind of two ways that this occurs. So some facilities order and administer their own vaccines, and it's all done in-house. Other facilities work with an external vaccine partner. So this is typically a pharmacy that orders the vaccines for the facility, and either the pharmacy comes in and gives them, or they just order them and then staff within the facility give them. So right now, or previous to this, but right now, if you have not ordered your vaccines for the next season, that should probably be #1 priority as far as planning for your vaccine campaign. So if you order them in-house and you haven't done that before, maybe you're new to your position, checking with your supervisor about how you get that process started right now would be beneficial. If you work with an external partner that orders your vaccines and you haven't confirmed with them, or you don't know if they've ordered the vaccine yet, I would say that would be your first step as well, is checking with that vaccine partner and asking, have you ordered? What have you ordered? So I'm seeing some great answers in here. I'm just going to take a minute and look through. I'm seeing a good mix. So this is great. It's really great to know that there is a mix. I see that some have ordered flu, but not the other ones. Maybe some people that are unsure. Erin, thank you for sharing what you've ordered. I might call on you to come off and sort of talk through us how you decided what formulations of flu to order. I would love to hear your process on that if you're willing to share. And then Cheryl, I mean, gosh, this is so great, you guys, to know the variations in this. So Erin, would you be willing to come off mute and talk to us about how you decide what formulations of the flu vaccine you order?
Can you hear me?
Yeah, I can.
It's my computer's on a docking station, so my microphone is covered, so I apologize.
No, I can hear you well, actually. Thank you for.
Good. No, we have a very large campus. We have roughly almost 900 residents. on campus, including our 3 licensed care areas. We roughly have about 400 employees. Our numbers are really kind of driven as we've, done our flu vaccine clinics year after year. So we've kind of tailored that. So obviously our percentage is a little lower for staff when it comes to quadrivalent. That's why we only ordered 180. But we do put out a lot of information out there campus wide on the dates. We have 2 dates that we partnered with our community college to administer and be a part of the process, obviously. So we do our billing in-house as well. So we really just try to drive our dates and really kind of put the information out there in resident in-house boxes and of course our licensed care areas, making sure the spouses and those that need to have their health care assigned family members to sign off on their administration, obviously kind of pre-do our forms, if you will, prior to our flu vaccine. So that's kind of how we try it. Our numbers are not, they're not ideal either. Sometimes we have a lot of leftover. Sanofi is a direct supplier that we use that produces the vaccine. So we have an account already established with them. So what we do is they have a buyback also. So there's a certain time of the year where they'll accept our leftovers, if you will, and so they give us credit on those. But we're doing such high volume, so I think that's probably to our benefit to be able to use them directly. So anyway, that's kind of how we went about it.
Awesome, Aaron, that is so great. I'm going to ask you a couple follow-up questions. When do you order your vaccines?
So we already ordered. We ordered about a month ago, roughly. I just dialed in this past week. I added a flu block, which is kind of a newer vaccine. Some of you may know that obviously with egg allergies, it's a little harder for people to accept these vaccines. So it is egg-free. So the flu block, and it's spelled exactly as L-O-K. It's actually kind of a higher dose. If you do the research on it and just Google it, it's actually approved for 18 and over. So some of your younger staff that may be working like that wouldn't be applicable to them, but 18 and over is approved for for those egg allergies. And again, we only did 40 doses of those, but it's nice to have a variation offer, wider range.
Yeah. So Aaron, you were cutting out a little bit, so I'm just going to summarize what you said quickly. So that flu block is for people who have egg allergies. It's just a kind of an alternative. You don't need to order a ton of these. In my experience, it's a much smaller population, but is very nice to have on hand. The high dose vaccines tend to be what's recommended for the majority of residents that would be in our facilities. So if you have questions on the different flu formulations, we would love to help you sort out what to order and why based on your facility size and needs of your residents and staff. Aaron, I just so appreciate you kind of walking us through that. If there's anyone who has questions for Aaron, I know he was breaking up a little bit, but we would welcome you to come off mute and ask. We do recommend that facilities start to order their vaccine kind of between March and June for the following year. Some facilities will order even as early as February. And oftentimes you look at kind of your past numbers and get an average of what you need. So if you've done vaccines in the past, you should have a good idea of how many you need. If you've never done them before, that is a little bit trickier. And if you've never ordered them before, and we'd love to help you with that process and talk through that with you. So please reach out to us or come to our office hours and we can talk through that. I see that some of you order flu vaccines, but maybe not COVID or pneumonia, or you order, it looks like a lot of people order flu. Is anyone willing to come off mute and talk about how you decide to order flu versus flu and COVID and pneumonia? What plays into that decision for you as a facility?
This is Barbara.
Hey, Barbara.
We order the quadrivalent flu dose for all our residents. But when it comes to like pneumonia and the COVID, because we have to have, well, now they have single doses, but like the pneumonia, I just order those. I will go in and talk with the resident stating, okay, you know, you haven't had a pneumonia vaccine. This is what is recommended. And if they want to get it, then I just get their consent, get them to sign that. And then we order it and the pharmacy sends it out to us and we get it the next day.
Okay.
And the same for COVID, we can order that singly. But usually, just a second, I got somebody at my door. We wait till we got enough doses to give.
I can do this.
And I'm on a webinar right now and I'm talking. Okay. Okay, sorry about that.
No, that's okay. That's real life. I know you guys are all at work. That's totally okay.
And so it's mainly the flu that we order in bulk because we can get it cheaper that way. But the pneumonia and the COVID, we order those individually when we have people who want to get those.
So
And-
let's talk through that a little bit, Barbara. If you ordered COVID in bulk, similar to flu, is the concern that it would go unused and expire?
Probably, yes. I mean, you only have, once you puncture the vial, you only have like 5-6 hours
Right.
to use up the vaccine. And so they now have single doses. So
Yeah,
if
I was
one
just going to
person
say that.
who wants it, I can do that. But if I have like 3 people who want to get it, I will order a vial, but I'll also try to find 3 other people that I can give another dose to, a booster or something. Currently, we're working on getting all our TDAPs up to date because a lot of our people's TDAPs have expired or they've never had one.
Right.
And so we're working to get those up, but that's another vaccine that here again, I can go in, talk with them, discuss the vaccine information sheet with them, get them to sign a consent once they just make the decision to receive it. And then I order it and the pharmacy sends it out to us the next day.
Okay. Barbara, thank you so much for sharing that. I would be interested to hear if anyone has started ordering the single dose COVID vaccines yet. Has anyone ordered those? So I know for much of the pandemic, the hard part about COVID vaccines is what Barbara was speaking to, which is once you open that multi-dose vial, you only have so long to use it. And it's a waste if you don't have that number of residents ready to go. Our understanding is there's now single dose vials available of COVID. I would be interested to know, are they really available? Has anyone tried to order them and been able to get them? No. Okay. I'd also love to know about, for those that give them themselves, if the reimbursement process is any differently for that through Medicare.
Jenny, Rachel asked a question in chat.
Okay.
She asked if you're asking about the XBB monovalent that's not yet available for the single dose, I think is what she was referring to.
As stated by, oh, okay. So it isn't available right now to you guys, Rachel. That's what you're saying. The last we checked, it said that they were having them available for ordering. So that's interesting. But they're not. Okay. And Barbara, you're asking, will it be a monovalent or bivalent vaccine? And it looks like Erin said monovalent will be available this fall. Yeah.
So it won't be a bivalent booster. It will be a monovalent that we'll have to give for that XXB.
Yes, and again, I need to go back and review the most recent guidance. Ashley's saying that the XBB monovalent doses were approved by the FDA, but ACIP hasn't approved eligibility guidance yet. Yes, so they're anticipating they'll be available this fall. So it sounds like the newest ones approved are the monovalent doses. Yeah.
Jennifer has her hand raised.
Yeah, Jennifer, go ahead.
Hi, this is Jennifer, calling from Tacoma Pierce County Health Department. I have been talking with some of our local independent pharmacies, and they've been talking to us about, the commercialization of COVID-19 vaccines. And I do understand that the Moderna reps are connecting with the independent pharmacies, starting to pre-book orders for the fall vaccine. So I know that's been going on right now, and I don't know if they've been connecting with the long-term care pharmacies.
Okay. So that's something that we as the Comagine team will start looking into and update you guys with what we find as well. If you're able to order that vaccine yet, if they're starting to take pre-orders or not, that's something we can start looking into as well as the Comagine team. And Aaron asked, is the current up to date is 1 dose of the bivalent right now? That's my understanding, Aaron, is that is the current up to date. Yes.
This is Barbara. I just have a quick question. Have we heard anything else about any other variants emerging other than the XXB?
I have not. So this again is where we are trying to stay up to date with all the things coming out. So I have not heard anything different than that, Barbara. But we can continue to update, and we can provide updates at the vaccination station. Also, we can send out that key learnings document, and please feel free to communicate with us. If you, we know sometimes that facilities, Aaron, it sounds like your facility might be one of them. These larger facilities get approached by the pharmaceutical reps really early about ordering. So feel free to email us, contact us if you start to be able to order these early. I think the main takeaway for this is that ordering vaccine now should be a high priority. So whether you do that directly through your facility or reaching out to your vaccine partner, I see in chat that Rachel said that she'll reach out to their, I think, RX pharmacy to see if they have access to ordering. So just starting that communication and knowing exactly who you're communicating with there, and that that you're ordering what you need to be ordered. There's also lots of, not lots, there's a few new pneumonia formulations that are coming out, and that is kind of a whole other topic of conversation. We can put some updates on that. But if you're wondering what pneumonia formulations to have on hand, we'd be happy to talk through that with you as well. There's a PCV 20, a PCV 15 that are out that can actually help streamline giving pneumonia vaccines. We'd be happy to work with that. So come to our open office hours on the 27th, or just email me directly, and we can chat over email or set up a one-on-one conversation if needed. Okay, so in addition to vaccines, thinking through what additional supplies you might need. So this are things that are pretty simple, like gauze, Band-Aids, alcohol wipes, ice pack, syringes or needles, sharp containers, all things that can be kind of an afterthought, but if you don't have them, can be rather stressful and can add up expense-wise. So including those on the front end in your budget and making sure that you have them on hand. And then finding the actual physical space where you're going to do this and reserving that space. So working with your facilities, administration, who exactly is going to be setting up the area, the tables, the chairs, who's breaking it down, and then selecting your tentative dates and getting those on your facility calendar. If you need to coordinate with an outside vaccine partner like a pharmacy or a school of nursing, getting that date secured now, just because calendars fill up really quickly in the fall. I think we all experience this between vaccines, holidays, that calendar fills up quickly. So getting those dates scheduled internally and externally if needed. And looking at October, November, usually vaccines happen by at least October. So looking in October to schedule some tentative dates internally and externally. Again, finalizing those dates and times, staffing schedules, promotional activities. We talked about this briefly, can include emails, postcards. I know someone put in chat, if you have a hard time getting a response from family or power of attorney, considering sending out the information with the bill kind of all in one. I know sometimes like my power company sends out information about that they want consumers to read with your bill because they know you're going to open your bill. Kind of the same thing here. That's one way to include promotional or educational material is with families and power of attorneys. Considering lunch and learn events for residents and staff. If you've never done a lunch and learn event, we'd love to help you set that up. We'd love to help you do one. If you're interested in doing that, we would recommend doing it in August and September so that there's time for conversations after the lunch and learn if residents want to talk through more or have time to think about it, doing it in advance of when you're going to be giving the immunizations. And then we do have an immunization tracker tool. It's a pretty simple tool that can be used in conjunction with a state immunization registry. If you already have an internal way that you track, like you have an EHR that you track immunizations, that's great. We know that there are some facilities that don't have that ability to track internally yet. So we have this tool that we'd be happy to share with any organization that's interested. We can also offer technical assistance around the best way to use this tool internally so that you're accurately tracking your residents' immunization status. In addition to that tool, we really encourage every facility to get set up with your state immunization information system. So every state has one of these. It's a secure web-based registry tool that keeps track of immunization registry records. So the idea is that any entity that gives a vaccine, whether it's the health department or a doctor's office, a pharmacy, a skilled nursing facility, they're entering in that immunization information into this registry so that if that patient goes to another place, that provider can look up their immunization status. So if your organization is not enrolled, you have to complete an informed sharing agreement. There's different options for view only if you just want to be able to view, like if you don't give vaccines at your facility, if you're an assisted living facility, for example, you can still register for a view only option. And then this is another way that facilities can look up your resident vaccine status. So if you have a problem finding, for example, your resident's pneumonia status when they're being admitted, registering for your state immunization registry and using that resource can be a great way to look up your resident vaccine status. So there is a link we're including in the chat so that you can kind of see how you can get set up with your state immunization registry if you haven't. If you need additional help with that, of course, we're here to help. So next steps, looking forward to the next month for some action items. So before we meet again, we would encourage you to schedule a vaccine campaign kickoff team meeting. So again, setting up your email group, we can help with that if needed, scheduling your kickoff meeting, selecting dates for your facility's vaccine clinics, and getting those on your internal calendar and working with any external partners to get those dates on their calendars as well. Coordinating with your vaccine partner to order vaccines or ordering vaccines internally in the next month. That should actually be priority number one. That should be the top of the list to do. And then finalizing that worksheet, pages 4 and 5 of the worksheet with your team members. So really lining out exactly what resources you'll need, what's your budget, and talking through that. Okay, so our next session is going to be on Tuesday, August 8th. We're going to be talking about planning and promoting the campaign. So really getting into the nitty-gritty of how to start promoting it, reaching out to families, powers of attorneys, to get people on board for this and to start having conversations early. So if there's questions, concerns, that those questions are happening kind of in a non-pressured way over the course of a month or so before you actually start offering them the vaccines. Okay, I'm going to pause here for questions and comments. I see there's a lot in chat that I haven't kept up on. Oh yes, Erin, thank you. The Numerix Vax Advisor mobile app is so helpful. We recommend that to a lot of our clinical partners. So I would highly recommend that if a facility is not already using it to help you decide who needs a pneumonia vaccine and what pneumonia vaccine your resident or patient may need. What other questions? comments, concerns, needs that you guys have in this area that maybe we haven't addressed today? So here are all of our contact information. Feel free to email any of us or all of us with specific questions. We'll also be sending out this recording, our slides, and a key learnings document where we'll try to kind of highlight some of the key things, as well as try to get more information about the ordering for the monovalent COVID booster for this fall. We'll look into that and see what we can find out about being able to order it. We would encourage you to really come to our office hours. It's a very unstructured time where people can just come with your specific needs or clarifications, as well as email us, and we'd be happy to work with you, provide that one-on-one technical assistance. We know that every facility has a different situation. We work in a 6-state region that includes Washington, Idaho, Oregon, Utah, Nevada, and New Mexico, and even between those states, it varies so much what resources are available within your state or within your county. And we know that, which is why we don't want to offer kind of a one-size-fits-all approach. But we are here to sort of work with you for your specific needs and your specific context. So truly, please don't hesitate to reach out. There's no question that's too big or too small for us to help with. Last little plug for our survey. We will put the survey link in chat. It will take you 2 minutes to fill out, and we just really value the feedback. We want this time to be helpful and meet the needs for all of you. So please take time to fill that out. We do look at them and adjust our content accordingly. So there will also be a pop-up screen when you log out of Zoom to take the survey. And again, it'll take you like 2 minutes to do that. So please do that. Thank you all so much for joining us. We value this time with you so much and just really appreciate you taking the time to share. So thanks to everyone who came off mute and shared in chat. We really appreciate that. And we will look forward to seeing you at our office hours or next month.
Amy did have a question in chat.
Oh, okay. Let me look here. Are we able to get immunization records access to other states? I'm on the border of Washington and Idaho, and we even get Montana residents. Can I get access to Idaho and Montana immunization records? Great question, Amy. I do believe that for those border towns, there is a way that you can get access to the other states' immunization records. It'll usually be as a view-only option. So they won't want you entering into their state immunization registry, like if you're located in Washington. But I believe you can get like a view-only account for like Idaho and Montana. So I believe we dropped into chat a link for the different state registries. Is that correct, Edie? Did we put that in there?
No, that was last month.
Okay.
But we can
We put the link and I just put it again.
Oh,
great.
great.
So right to
Thanks,
the state
London.
immunization registries. Absolutely.
Okay.
Oh, great. Thank
So
you.
those are links to all the state immunization registries. If there's a state that you really need, like I'm not sure we have Montana on there, Amy, because it's not one of our 6 states we work with. I think you could probably go to their state website, like Idaho Department of Health and Welfare is where I have gone in the past to find our state registry. So if you go to the Montana Department of Health and Welfare, you'd probably be able to find the link to it or an email contact to email someone. Let us know what you find. I think for Idaho and Washington specifically, there's agreements to get view-only registries for border towns. So let us know what you find. Okay, thank you all so much. Please stay in contact with us by email, come to our office hours. We're hoping for just our best immunization season yet. So looking forward to talking with you guys, working with you. We'll see you next time.